Just here in Austin alone, we have people in some zip codes that live 10 years longer than people in some other zip codes. We cannot call ourselves a healthy community as long as we see those kinds of disparities.
Central Health has launched a planning effort that will transform how healthcare is provided and improve the lives of everyone in Travis County.
Created by Travis County voters in 2004, Central Health is the healthcare district for Travis County. Part of our statutory mission is to provide access to healthcare for those that need it most. But we also want to challenge the status quo. And we know it's important to step back and through an equity lens, look at these systems of care to make sure that they are the best that they can possibly be.
Equity is about fairness. It's about justice. It's a principle that says we value everyone equally. No one is more important than anyone else. So if we apply that to health, people's physical, emotional, and social well-being, systems planning gives us a chance to take care of people across a lifespan. And rather than dealing with episodes, what it lets us do is think about people from the perspective of prevention, from taking care of conditions that they have, from improving them all the way down to comfort.
Now, this work is not entirely new to Central Health. In fact, for years now, Central Health has been putting the building blocks in place: specialty care, primary care, new clinic sites. We're just simply taking everything to the next level.
Removing barriers to care, providing increased access to care, and access to quality care rapidly increases patients' health equity.
Within Central Health, we are a team of case management specialists that identify complex patients in different settings, mostly within the hospital setting. Our team navigates patients through the transition into healthcare outside of the brick and mortar building. Our case management team makes sure that when a patient left the hospital, they had an appointment scheduled, they are connected to their medical home, and ensure they're able to get to and from their appointment. I can see systems planning expanding our teams in a way that we have more reach. We would be able to make sure that we can send a patient to a specialist and there will not be a wait list. We will make sure that these patients can get the access and care that they need so they don't end up back in the hospital.
The systems planning effort for us is a great opportunity. It allows Central Health to take a step back, take a full view of the system, do deep dives into the different components of our system. We identify gaps and then we prioritize those gaps. And based on those priorities, we'll be able to lay out a blueprint of the work that Central Health needs to do over the next 3, 5, or 7 to 10 year time frame.
Once we have that blueprint and the Board of Managers adopts it, we'll figure out how to turn that plan into a reality for our community and how to fund that reality for decades to come.
I have the privilege of working with the operations team that's going to help make this plan a reality by working with existing partners as well as forging new paths with new partners.
Building comprehensive programs really requires a year-over-year effort. Things like bringing dialysis to our patients for the first time. Dialysis has typically not been available to our patients in an outpatient or home-based setting.
We're again removing a barrier to care. We increase their opportunity to succeed, therefore advancing health equity.
So we're getting closer to where we want to be, and I think our patients are really appreciative of that. About 13% of the population in Austin has diabetes. Patients who come to community care actually have a really wonderful collaborative care team environment.
Hi, my name is Selena Ramos. I am a mother of 3. Before I got pregnant, I was worried that I was not going to make it much longer just because my blood sugars were everywhere.
Diabetes care is really a team sport. So the patient starts getting education from the minute that they enter the clinic. They may spend some time with a clinical pharmacist or a registered dietitian. They have a whole group of people who can really wrap them in care, and that helps them stay healthy.
Now I have all these things going on. People who actually care You know, I actually have doctors that will talk to me like I'm a person. I feel like I have a higher quality of care because of that.
What is it that we can do to make the systems of care better, to have equitable outcomes for everyone? And that's what we're aiming to do with the systems-based initiative. Taking the lead on the design and working with our partners, community leaders, advocates, that's what we want to bring to Travis County.
Once we built a high-functioning, comprehensive healthcare system, the patients that we serve will be able to focus their energy on getting better and feeling healthier, and trust that the system that we built will be there to support them in that work.